Life before climate, very very medieval, as I would describe it, because it was done using massive sets of notes, sometimes difficult to dig out very crucial pieces of information which could be buried in any place in those notes. Yeah, the key challenges for the service were increasing awareness that there was a patient safety issue, as patients had comorbidities and other specialists engaged with their care that could result in people being prescribed medications which were not compatible with the medications we were giving. So there was a patient safety issue. There was also the issue around facilitating a care for the patient where it was possible for other clinicians to get engaged in their care in a meaningful way without having the barriers of information being hidden from them. And then there was also a quality issue in terms of not having a system in place where we could at any one time see how many patients hadn't been seen for a year, for 6 months, why haven't we seen them, because they've dropped out of the system for whatever reason. We had issues around developing commissioning and statutory data returns. Those were all done manually, and it got to a point where it became increasingly untenable to do this in a meaningful manner, and hence the need for a clinical database that would meet all those needs.
In terms of the differences before and after the implementation of climate, prior to climate HIV, we had no electronic database, so we were reliant entirely on paper records. We have other electronic systems within the trust for pathology results and radiology results and things, but all of our clinical entries were made in paper records, and obviously paper records often go missing or can't be found when patients turn up, or if you need to make a phone call about a patient, for example. So I think one of the main benefits is that with everything on an electronic system that you can access from really anywhere within the trust, you can then see what's happening in that patient's care previously and currently to help you manage them.
I think if I was to try and summarise climate HIV, it would be an electronic record that we can use to record the patient's consultation, their current medication, their adherence, any alerts, and that's particularly important perhaps when you're seeing patients that are not patients that you normally see. They might be patients of colleagues, so you can look for the alerts. You can also use it to demonstrate to patients important features. So for example, their CD4 count and HIV viral load are tracked and graphically illustrated.
Climate HIV has a patient dashboard, so when you click onto a patient at a glance, you can look at their major clinical performance indicators to see how we're doing. You have the full drug history there, you have the main medical comorbidities listed there, and it is a very doctor-friendly environment to sort of, it's designed at managing patients rather than a management tool which has been adopted to also be doing clinical work from.
The main advantages I've found personally with climate HIV have been the fact that the notes are always available. We also have the CD4 count and HIV viral load automatically pulled into the system, and therefore we have the results present without looking through our records to get them. It also helps with discussions with patients because they have a pictorial form of their own journey. I work on 2 sites. I also do clinics outside our main hub, and therefore it's an advantage to be able to access records when I'm not in the main hub.
On the management perspective, we were struggling every year to complete SOFID returns because they had to be done manually, to complete our quarterly commissioning returns because they had to be done manually, and we just did the best job we could. And it's only transpired since climate of how incomplete our records were and how much revenue we were losing on a quarterly basis. So that's all changed. The equivalent of the SOFID returns, which is now the HARS data set, is available real time at any one time. We want to develop a HARS report, it's there, it's up to date. And clinical management is completely changed because patients are now connected with the rest of the hospital systems. It makes it for a much better, safer environment to manage patients in.
Public Health England's requirements of HARS are 100% met by Climate HIV. It's really quickly and easy to create a report. It takes me less than 2 minutes to create a report and upload it to Public Health England. Climate HIV definitely saves the NHS money. Before Climate HIV, we didn't know how much ARV drugs were costing per patient. Now we know exactly how much and we can budget around it. I'm very satisfied with Climate HIV. I recommend it to every data manager that I speak to who has to look after HIV patients and submit a HARS report.
I think in terms of patient care, Climate HIV has been an excellent purchase and very good for our patients attending our service.
Clearly able to manage them much more proactively and much more safely because we can see trends of results beginning to go the wrong way much before the patient starts to feel ill, and that's the whole point of providing good care and good follow-up. So it's certainly made for a much safer, much better working environment.
I think Climate HIV has made a significant difference to our risk profile. Firstly, we are able to have concise, clear records. They're standardised. We're able to put alerts onto the system so that we know what we need to do for a patient and there's less chance of us missing that. We're also able to ask in a structured way about adherence and record it so that we know what the patient's compliance has been. And we're also able to use the notes more consistently for audit and assessment of clinical practice.
Clinical environment is much more conducive to good practice. I think we feel much more safer in managing our patients. And what has also changed as a service manager is that now I don't have sleepless nights before the due date for returns as to whether I'll be able to complete it on time or not, because it's available at the press of a button now.
Since we've introduced Climate HIV, it's saved more money in drugs than it cost to put in to start with.
So like last week because the trust was upgrading our operating system, there was a bit of a hiccup with climate, and suddenly all hell was let loose because they haven't got climate. And I think that tells you how much people are now really relying on it and how much they're actually using it, because if it's not there for one day, we do feel the void. Yeah, that tells you a story.